Hey guys, welcome back to the Kelvin TV. Have you been to the ICU before and seen all those machines or all those devices around a patient before? Then you ask yourself, what is the purpose or what are the uses of all these devices around this particular patient? In this video, we are going to learn about the critical care devices, the devices that are being used in the ICU. I know most of you have seen these devices countless times. And most of you have even used some before. But a lot of us don't know the reason and the purpose of these devices. If you find yourself at the ICU or the critical care unit, then please, you need to know these devices because they will help you so that you won't make any mistake. Because any mistake you make on this or any of these devices we are about to talk about, you are going to cause a patient harm. Whether you are going to end the patient or comes with another complication. So let's get into the video. The first device that we are going to talk about is the cardiac monitor. I know you've seen the cardiac monitor before. When we talk of the cardiac monitor records all the electrical activities of the heart. So, and never recording all the electrical activities of the heart. So it helps us to know the heart rate, the heart rhythms. Then also, it will help us to know whether there's any complication to the heart or there's any abnormalities in the heart so that we can detect it faster and help the patient. Then the next one that we are going to talk about is the pulse oximeter, which is being used to check the SpO2. This one is, this device measures the oxygen level. And this one is going to help us to also know about the level of oxygen in the patient. Then also help us to get to know the respiratory effect or the effectiveness of the respiratory interventions. And you know, say the normal range for oxygen and our oxygen saturation is 95 to 100. So you need to know this so that you won't cause any problem to the patient. Then the next one is the urinary catheter. I know it's a catheter. They always say, oh, catheter, please. The catheter is used for a purpose. Most of us think the reason why is a patient need to miss please, you use the catheter and use it to measure the urine output. And this one is going to help us to know whether there is renal failure or there is imbalance in the body. So please, get to know these devices. Then the next one that we are going to talk about is the arterial blood gas analysis. Arterial blood gas analysis. It is also being used in the critical care unit. This one is going to measure the level of oxygen and carbon dioxide in the blood, and also the blood pH. I know that if you've learned about the acid-base balance in medical crisis 1, this thing you need to know about the arterial blood gas. When we talk of the arterial blood gas, talking about the amount of oxygen and the level of oxygen and carbon dioxide in the blood. So this device, help them measure the amount of oxygen, then the carbon dioxide in the blood, and also it is going to also monitor the blood pH. That's the use of this machine. Then we have the capnography. We have the capnography. When we talk of the capnography, it is also a device that measures the concentration of carbon dioxide in exhaled breath. It will breathe out. This device is going to measure the concentration of carbon dioxide in exhaled breath. Then the next one is we have the suction machine. I know say when you suction machine that suction machine. This one is a device that's used to remove secretion, blood, and mucus from the lungs or other places there blockade the panoid and I say baby. That's the use of the suction machine. So guys, let's move on. We are moving to the central venous pressure monitor, and as a device. So this device is going to measure the pressure in the vena cava near the right atrium of the heart. And this one is going to indicate the patient's fluid status and also the fluid resuscitation in a critically ill patient. That's the work of the central nervous, the central venous pressure. Then the next one that we are going to talk about is the nebulizer. When you talk of the nebulizer, I know say what could be that. Of course, but should be this device is going to turn a fluid medication into a mist for inhalation or for inhalation. So what I say, it's going to turn what? A fluid medication into a mist for inhalation. Then the next one that we are going to talk about is the intracranial pressure monitoring, and as a monitor. This device is going to what? Measure the pressure in the skull into the subarachnoid space. So another then measure the pressure in the skull in the into the subarachnoid space. So that's the work of the intracranial pressure device. Then, so the next one that we are going to talk about is the defibrillator. When we talk of the defibrillator, it's a device that controls the electrical shock into the heart to restore the rhythm. So it controls the electrical shock into the heart and the electrical shock into the heart to restore the heart rhythm. So guys, thank you for watching. Keep on watching this Kelvin TV. So in case you want me to shoot on any other video, you can drop it under the comment section. You can also join my online class on anatomy, pharmacology, and other courses, and it's going to help you a lot. Keep on watching this Kelvin TV. I love you.